Let's talk about two words that, can sound pretty scary when you put them together: lumbar fusion. For so many people, the idea of spine surgery just brings up these images of long, painful recoveries and losing your ability to move. But what if I told you that for the right person, a modern fusion is actually the key to unlocking more movement and getting your life back? I'm willing to bet this is the number one fear, right? The idea that fusing even one part of your spine is going to leave you stiff as a board, unable to bend or move naturally. And look, that's a completely understandable concern. But today, we're going to challenge that idea head on. Okay, let's really unpack this, because this quote right here, it completely flips the script. It suggests that the problem isn't your normal movement. The real problem is that painful, unstable, abnormal movement that's already holding you back. So by stabilizing that one single problem level, you're not locking up your whole spine. You're actually giving all the healthy parts permission to finally move freely again without that constant fear of pain. Exactly. Think about it like this. When a part of your spine is unstable, it shifts and grinds in ways it's not supposed to, and that really irritates the nerves. So what does your body do? Its natural response is to guard against that pain. It tenses up, it tightens, and it limits all your movements. So the fusion doesn't take away motion, it takes away the very reason your body was preventing motion in the first place. So what's actually causing this instability? To really get why the solution works, we've got to have a super clear picture of the problem itself. Well, the main culprit we're often talking about is a condition with a very long name: spondylolisthesis. But don't worry about the word. All it really means is that one of your vertebrae has slipped forward, out of its proper alignment. And that slip creates this little biomechanical mess, narrowing the space for your nerves and causing that unstable feeling you might get with every single step. You know, the best analogy I've ever heard is to think of a door with a loose, wobbly hinge. When that one part is off, the whole door just doesn't open or close right. It gets stuck. You wouldn't replace the entire door, right? No, you just tighten that one broken hinge. A lumbar fusion works on the exact same principle. It stabilizes a single point of failure so the entire structure, your spine, can function the way it was designed to. Okay, so how do surgeons actually go in and fix that loose hinge? This is where modern medicine has made some just incredible leaps. Seriously, forget anything you might have seen in old movies. Today's techniques are incredibly precise, they're minimally invasive, and they're all focused on getting you back on your feet faster. Just take a look at the difference here in how the muscles are handled. On the left, you've got the traditional open approach, which often meant a big incision and stripping muscle away from the bone. But look at the right. That's the modern, minimally invasive technique. The surgeon makes a tiny 1 or 2 inch incision and then gently separates some muscle fibers, basically creating a small tunnel to work through without all that damage. And that muscle-sparing technique is what leads directly to all of these amazing benefits. Less disruption to the muscle just means less pain and a much quicker recovery. Then you add in things like robotic assistance for millimeter-perfect accuracy, and you have a procedure that's so refined, most patients can actually go home the very same day. That's a huge deal. Now, you might see terms like TLF and PLF. Surgeons have different tools in their toolbox for different situations. You don't need to be an expert on them, I promise. The really important thing to understand is that the surgical plan is always personalized. The surgeon chooses the absolute safest, most direct path to stabilize the spine based on your unique anatomy. All right, let's pull back the curtain and really demystify what actually happens during the procedure itself. I find that breaking it down step by step makes it a whole lot less intimidating. It's actually a very logical process. So after that tiny incision is made, the very first thing the surgeon does is relieve any pressure that's on the nerves. That's key. Then the damaged disc is carefully cleared out to make room for a special spacer, which restores the proper height between the bones. And finally, small screws and rods act like an internal brace, just holding everything perfectly still. So your body can do the amazing work of growing new bone and creating a solid, permanent fusion. The surgery itself is really just one part of the story. Next up is the recovery. And it's not a mystery, it's a structured journey with clear, predictable milestones along the way. And honestly, this timeline is often a really welcome surprise for people. The fact that you're up walking within hours of surgery and going home the same day, that's a total game changer. From there, it's all about gradual progression. You'll be walking a little more each day, getting back to most of your normal activities within a few weeks, and by that 3 to 6 month mark, most people feel a really significant, noticeable improvement in their function. It's so important to remember this. Those screws and rods, they aren't the fusion itself. They're just the scaffolding. They're there to provide stability so your body can perform the natural biological process of healing and growing bone. Your body is really the hero of this recovery story. And that brings us to the most important part of all, the why. Why go through this process? Well, it all comes down to the ultimate goal, regaining your function and getting back to the life you actually want to live. And the evidence for this is really strong. For patients who are carefully selected, the outcomes are so consistently positive. We're talking about a major drop in that radiating leg pain or sciatica, the ability to walk and stand for longer without having to stop, and, maybe most importantly, regaining the confidence to just move without that constant fear of pain. And really, there's no better evidence than hearing it from someone who has actually been through it. This patient's journey, it says it all. Going from debilitating pain to being back out in the garden in just a few months. That's what restoring stability is all about. It's not about limiting your life. It's about giving it back. Now, this is a critical question. It's so important to understand that fusion isn't a magical fix for all types of back pain. It's a very specific tool for a very specific problem. So who is the ideal candidate? Well, the decision is always based on a really careful checklist. There has to be clear confirmed instability that we can see on an X-ray or an MRI. The symptoms, like that nerve pain, have to be seriously limiting your daily life. And, this is a big one, you've already given conservative options like physical therapy a real honest try. It's only when that one unstable segment is proven to be the sole bottleneck holding you back that fusion becomes the best path forward. So if there's one thing to take away from all this, it's that we need to reframe how we think about fusion. It's not about giving up motion. It's about restoring the stable foundation that safe, comfortable motion actually depends on. For the right person with true instability, providing that support is the most direct way to get your motion and your life back on track. So if you've been listening in this whole story of instability, of not being able to walk far, of that nagging nerve pain, of a life that feels held back, if that sounds like your story, then maybe the next step is just a conversation. A professional evaluation can help figure out if stabilization is the missing piece in your journey back to doing what you love.